Greetings of the day, folks. Today we are going to discuss about the decision rules for assessment of fever in neonates and infants less than 3 months of age in infants. Okay, so clinical assessment of severity of the illness in neonates and the young infant is difficult, right? So we know that, but for this there are criteria like three from the great institutions. So, uh, so all like Rochester criteria, Philadelphia protocol, and Boston's criteria are there. All three have limitations for decision-making rule, but comparison is difficult because of differences in inclusion criteria, laboratory testing in these criteria. So we are going to discuss about their tabular form. In addition, the routine administration of antibiotic to a pregnant woman who tests positive for group B strep on vaginal cultures and improves the immunization practice have decreased the incidence of the serial bacterial infection, and it is making it difficult to extrapolate these three decision rules to current practice. So the Rochester criteria state that in well-appearing neonates and infants less than 60 months old 60 days, sorry, my mistake, 60 days old without prior or peripartum illness with a normal CBC, that is cell complete blood counts and negative urinalysis and a negative chest radiograph if indicated are sufficient to exclude serious bacterial illness. However, a Rochester criteria miss 1% of the patients with the serious bacterial illness and do not include lumbar puncture as one of the diagnostic tests. The Rochester criteria least sensitive of the three guidelines. In the largest validation study of the Rochester criteria cohort of 1057 patients included 511 who met low risk criteria, which we are going to discuss later on, and 5 patients or 1% of the patients identified as at low risk had a serious bacterial illness that was missed. So lumbar puncture was not included in the rules, so the criteria did not provide ability to exclude the meningitis. Of note, incidence of the meningitis was only 0.3% of the entire cohort, which is lower than the 1% meningitis incidence cited in most other studies. In summary, Rochester missed 1% of all the patients with serious bacterial illness and do not exclude meningitis. Coming to the Philadelphia, it includes the results of lumbar puncture in clinical decision making and includes young infants like 29 to 56 days old, and the sensitivity of the low risk criteria for excluding serious bacterial illness is 98% and specificity is 44%. And the positive predictive value is 14% only. Negative predictive value is 99.7. The temperature criterion is 38.2 degrees Celsius, not 38 degrees Celsius. The incidence of the meningitis in this cohort was 1.2% using the Philadelphia protocol. All the patients with meningitis were identified. One of the 288 patients who had otherwise met low risk criteria was identified as having elevated CSF WBC count alone. In addition, all cases of bacterium and UTI were identified by Philadelphia protocol. And now coming to the Boston criteria, it attempted to identify young infants at lower risk of serious bacterial illness and safely treat them as outpatient with empiric cephaloxone. So they are going to identify a patient of low risk of serious bacteria and safely treat them as outpatients with empiric cephaloxone. It included 28 to 89 days of age, so this is the highest one, and includes the longest age group in these three criterias, um, and accepted a peripheral WBC up to 20,000 as 20,000 counts as normal. Lumbar puncture was performed in all patients, and all patients with meningitis were excluded. In those who met low risk criteria, less than 1% had a missed serious bacterial illness and none had complications after empiric treatment with ceftriaxone. And by using Boston criteria, a great number of patients were discharged. Okay, so in those patients who met low risk criteria, less than 1% had missed serious bacterial and none had complication after empiric treatment with ceftriaxone. So subsequent studies applying Rochester, Philadelphia, and Boston decision rules missed serious bacterial illness in neonates, okay, like 0 to 30 days old. The safest course for 0 to 30-day old infants is sepsis testing and admission and empiric antibiotic treatment. So recognition of occult serious bacterial illness in well-appearing neonates and infants less than 3 months of age is difficult. Yes, right? So and no single clinical variable or diagnostic test can correctly or reliably identify this issue. In addition, as noted earlier with the Rochester, Philadelphia, and Boston criteria, these rules differ in their inclusion criteria. So the combination of variables can be helpful. A study from Boston shows statistically significant cutoff points for predicting variables for SBI. So, and also in order for, of greatest statistical significance for prediction were positive urinalysis, WBC count of more than 20,000, temperature of more than 39.6 degrees centigrade Celsius, and WBC count of less than 4100, and age less than 13 days old. No variable or cutoff point was 100% sensitive or specific. A number of meningitis cases was too small to lead to the inclusion of the results of lumbar puncture in the decision rule. This study challenges the previous study protocols by introducing clinical and diagnostic test variables that were determined to be statistically significant. Although this is not the standard of care, this added information may help determine different thresholds of for a fever evaluation in the neonatal admission uh, and antibiotic therapy. Okay, so let's just discuss the Rochester criteria in the tabular form. So this is a comparison of low risk Rochester criteria, Philadelphia, and Boston criteria for fever in well appearing neonates and infants. Okay, so this is low risk criteria, right? So patient, it will be identifying only those who will be having this. So this is Rochester, Philadelphia, Boston. This includes fever, age, past medical, physical examination, lab counts, and chest radiograph and comments. So this includes you can see this temperature. It is considering as more than 38 degrees Celsius or 400.4 degrees Fahrenheit. Philadelphia, Rochester and Boston are including only the 30 degrees Celsius, but Philadelphia is including 38.2 degrees Celsius or 100.8 degrees Fahrenheit. Age limit that is included in the criteria are less than 60 days or 2 months, or and Philadelphia is including only 29 to 56 days, that is after 1 month to 56 days. In Boston criteria, like only in infants, like post infancy, post neonatal period, that is 28 to 89 days, 3 months. So this is the Boston is the longest one, having includes the longest age group that is included in the criteria. The past medical history is term infant like more than 37, no perinatal antibiotics, no treatment for jaundice, no chronic illness for our admissions, no not hospitalized longer than the mother, and so included the past medical. In Philadelphia, no immunodeficiency syndrome is included. In the Boston criteria, they have included no immunization within 48 hours, no recent antibiotics. Coming to the physical examination, if the baby is appearing well and also there is no remarkable examination findings, so then it is considered to be, and same is included in the other criteria protocol too. So in the coming to the lab criteria, WBC counts more than blood in the blood count section. WBC counts more than 5,000 or to less than 15,000 with absolute band count of less than or equal to 1500. Okay, so and also in Philadelphia protocol, it is including WBC count of less than 15,000, but you can see here 5 to 15,000, this is to less than 20,000. Boston is including because it is the longest one. You can also think that WBC count is also increased. Okay, urinalysis. So less than 10 hyperfield. This is also same. This is also same. So 10 less than 10 per hyperfield. In coming to the stool, less than 5, and in this it is not included. In lumbar puncture, you can see here only Philadelphia and Boston are including, but the Rochester is not including the lumbar puncture, and chest radiograph is also not included in the Rochester criteria. So, and if it is negative, then the patient can be discharged. and WBC count in the CSF in the Philadelphia, and by it is 10 in posting criteria. If it is less than that, then patient can be discharged. And so just radiograph if it is negative, then it can be patient can be discharged. So as the Rochester criteria excluded lumbar puncture, so number of missed meningitis cases is unknown. UTI is missed in those with negative urinalysis. The least sensitive of the lower risk criteria is Rochester criteria because it is old one also. And the sensitivity of the Philadelphia is 98%, but specificity is low. Positive predictor very low, but negative predictor value is high. Then 5% of cases that are included in the Boston criteria are had a serious bacterial infection, 8 bacteremia, 8 UTI, and 10 bacterial gastroenteritis. It's 96% sensitive to ceftriaxone. So this is how the decision rules are made. Okay, so let's again go through the recognition. So is in well appearing patients, it is less than 3 months is very difficult. No single variable or diagnostic test can correctly or reliably identify it in the age group. In addition, as noted earlier, so these rules differ, so we must be careful. Okay, so this concludes the video. Thank you for this exhaustive reading. Thank you.